Hello, my name is Sophie Cortez. Today I will do my lab skill assessment, medication administration. First I will do hand hygiene and I'll start reading Dr. Sortes. I have Dr. Sortes and then okay, doctor order says patients 121-23-93, patient crash auto, female, date of birth 1960, February 20, allergies to morphine, primary diagnosis L2 compression fracture, secondary to MBA. Today's day, doctor ordered discontinue morphine and administered Ketorolac 30 milligrams every 6 hours intramuscular while awake for 5 days and then reassess. Now that I read doctor's orders, I didn't print my monograph, but I have my draft guide. So I will check the medication that the doctor ordered, Ketorolac. It says for adults, intramuscular, single dose 30 milligrams. So the doctor ordered here 30 milligrams intramuscular every 6 hours, and here says every 6 hours. So this is the right dose that the doctor ordered for the patient. It also have more information about the medications, and it says that do not exceed 5 days total. And so that's why the doctor ordered to reassess the patient. He ordered the Ketorolac since Ketorolac is a pain medication and our patient has allergies to morphine. Doctor wanna help our patient or prevent our patient from pain. And now I will check the mark and the doctor order. So I have here patient crash auto, male, hospital ID 121-23-93, hospital ID 121-23-93, date of birth 1960, February 20, date of birth 1960, February 20. Today's day is November 30, and it is 12 o'clock. No, the medication hasn't been given yet, and it is Ketorolac 30 milligrams Q every 6 hours intramuscular, Ketorolac 30 milligrams Q every 6 hours intramuscular while away for 5 days, and then reassess. So they match Dr. Sortes. So now that I'm in my Dr. Sortes, I'm gonna put Dr. Sortes on the side, and I'm gonna print the medication. So I have in my vial, this is a practical vial, don't have information about the medication, about the patient, sorry, just the medication. So I have crash auto, male, hospital ID 121-23-93, date of birth 1960, February 20, today's date November 30, 2020, it is 12 o'clock, and the medication is Ketorolac 30 milligrams. I have Ketorolac 30 milligrams every 6 hours intramuscular. It says route is intramuscular or IV for 5 days and then reassess. So this is the right medication. The expired date is April 2025. In this medication we have 2 mLs and 30 milligrams equals 1 ml. So I will do MedMat on a sticky note. So 30 milligrams equals 1 ml. my medmat done. I'm gonna put a sticky note close by, and I check the medication with the marks. I've done my first check, and now I will bring the rest of my supplies. Since we have to withdraw 1 ml, I'm gonna choose a 3 ml syringe, expired day April 2024, hasn't been opened yet, it's intact. I also gonna use a Blumfield needle without filter since it's a vial, I don't need a filter. And this expired April 2025, it is intact. And I'm gonna, since the intramuscular injections are between, the range are between 18 to 27 gauge, I'm gonna choose the 23 gauge and 1 inch injection, since I will use the deltoid muscle for my patient, and since it's only 1 ml, I could use that muscle. If it were more, I will use the ventrogluteal muscle. Okay, now that I have everything ready, I will do one more time my hygiene, and I'm gonna bring alcohol swab. I'll bring the vial for 30 seconds. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now I'm gonna let air dry, and I'm gonna get ready with the syringe. Okay. And now I'm gonna have some air in my syringe. I'm gonna put the same amount that I'm going to withdraw from the vial. Okay, I have 1. I'm gonna put some air first. Okay, and now okay. Sorry. Just wanna make sure you can see no bubbles in there, but I will make sure when I change needles that I don't have any bubbles. Okay, so I have 1 ml. I'm gonna do 1 hand scoop technique. Okay, I'll double check for bubbles, and I think I have a little one here, so I'm gonna use my pen. Okay, one more time, no bubbles. And I'm gonna use the medication that I have in my Blumfield needle to prime my next needle. So I will pull the plunger out. So I need all the medications that I have here to prime my next. Okay. I will change needles now. and I discard it in the Sharper's containers. For the purpose of the video, some of my supplies has been already opened since I've been practicing. Garbage. And I'm gonna make sure I have 1 ml. Okay. Now that I have my medication ready, I will do a second check with my medication, the withdrawal, and the mark. So I have Crash Auto, male, hospital ID 121-2393, date of birth 1960, February 20. Today's date is November 30, 2020, and it is 12 o'clock. And the medication is Kerolac, so I have Kerolac, 30 milligrams. I have 30 milligrams per 1 mile. I did my MedMat, it's 30 milligrams per 1 mile, and I withdraw 1 ml every 6 hours intramuscular. Here says for intramuscular route for 5 days while awake, and then reassess. So this is my second check. I withdraw 1 ml that I'm gonna need. Now that I have done this, I will bring a piece of paper and I'll do my label. Okay, in my label I'm gonna use the Mars. So this is for Crash Auto. I'm gonna include the hospital ID number 121 23 93. Today's date November 30, 2020. It is 12 o'clock, and the medication is Kerolac. The concentration is 30 milligrams equals 1 ml. The route is intramuscular, and I will sign and my designation. So in my label I have patient's name, hospital ID, date, today's day, time, name of the drug, concentration, dose, no concentration, mean dose, in route, and my ignitions. We said the reason for this medication, this is a pain medication. That's since our patient has allergies to the morphine, we wanna try something different, so that's why the doctor ordered this. So I'm gonna put the label on the cap, so I don't wanna cover the medication. Since I have my label done, I will do one more time my check with the label, the Mars, and the medication. So we have Crash Auto, male, hospital ID 121 23 93, hospital ID 121 23 93, date of birth 1960, February 20. Today's day, November 30, 2020. I have November 30, 2020. It is 12 o'clock. Medication, Kerolac. 30 milligrams equals 1 ml. I have 30 milligrams. I have 30 milligrams equals 1 ml in the vial. We have 2 ml, so we have 2 doses in this vial. This says for intramuscular route, and the Bible says for intramuscular route, and I put intramuscular route. So I put my initials and my designations. Now that I have done my test check with my label, my mark, and my medication, I'm gonna get ready all my supplies to go to see the patients. So I'm gonna leave my medication in my med room because I'm not gonna use it. And now I'm going to see the patient. So I'll bring gas, alcohol swabs, and all the supplies that I need. Okay, so I'm going to the room. Hello, my name is Sophie Cortez. I'm a practical nurse student. Can I come in? And he says yes. So first I will do hand hygiene. Oh, sorry. And I will close the curtain to give you more privacy. How are you feeling today? He says he's feeling okay. So first I will want to confirm your first and last name. Do you mind? Say your first and last name. I'm gonna check with the right wristband here. So it says Crash Auto. I have in my mark Crash Auto. I bring my med, Crash Auto. Could you please tell me your date of birth? He says 1960, February 20. I have in my mark 1960, February 20. And I'll have in my label the hospital ID, and I'm gonna read it. Hospital ID 121-2393, Hospital ID 121-2393, Hospital ID 121-2393. So I got the right patient. Thank you, Miss Crash. Now I'm gonna explain you. Doctor ordered for you today Keroac. Keroac is a pain medication. And it's a short-term medication. The doctor ordered Keroac for 5 days, and then he will reassess. Since you have allergies to morphine, we wanna give you something for pain. Is that okay with you? And he says yes. Oh, this medication is intramuscular, and today I will use the deltoid muscle that is on your shoulder. Is that okay with you? And he says, yeah, that's fine. Okay, first I will assess my client. I will assess the level of conscience, and then I could assess my client's vital signs, and then I will assess the skin of the patient. And then I will let him know that when that he might feel a middle burning on the site of the injection, but this is normal. This medication it will make him a little bit drowsy, but it's normal for this medication. Okay, first I will grab some clean gloves. I'm going to assess the site of the injection. Since I don't have any volunteers with me today for the purpose of the video, I'll print a picture where the deltoid muscle is. So first I will choose the site, and I'm gonna choose the right side of my patient, and then I will palpate the acromion process, the bony part here on top of the shoulder, and I will put 3 fingers down, and I will make like a little big shape. This is a small picture or printed, but I will make like a kind of a big shape here, and then I will inject the medication in the muscle. So 3 fingers down from the bony part of the shoulder, that is the acromion process. Okay? Now I will check the skin of my patient. I'm gonna move this a little bit. So when I'm assessing my patient, I'm gonna assess the skin. I'm looking for hematomas, inflammation, redness. He says, no, I will assess even the pain. So do you have pain at this moment? He says, no, at this moment. He's not feeling too bad. Okay, I will assess any lumps, abscess, tenderness, or muscle atrophy in the deltoid muscle. I'll choose already the site. So I'll gonna clean with an alcohol swab first. I can put my alcohol swab where I'm going to administer the injection. So as I said, 3 fingers down, and in the V shape I can inject my medication. Okay. So I'm gonna, from the center, and I'm gonna clean the site for 30 seconds. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 30. And I will let it dry. Meanwhile, I'm gonna make sure the bed is in the highest, is in my working level position for me. And I'm gonna ask my patient if he's okay. He gave me the consent to administer the injection, and he says yes. Okay, this is a intramuscular injection, so we can hold that on the site of the injection and then administer the injection. So I will. Okay, now it's air dry. I'm gonna get ready the gas. And I'm gonna put it in my fingers here, so it will be closer. And I'm gonna hold it a little tight. And I know I make a mark there, and I'm gonna inject my medication there. Okay, gonna remove this. This is. Okay, bear with me. I'm gonna touch your skin. 1, 2, 3, and I'm gonna inject slowly, about 10 seconds per 1 ml. I'm gonna wait a little bit. I'm not gonna recap my needle. I will start in the garbage container. I'm gonna do a little gentle press. We don't wanna massage or rub the side. Okay, how are you feeling? He says he's feeling okay. I'm gonna discard this. I'm gonna remove my gloves, and I'm gonna do some patient teaching. I will let my patient know that this medication is scheduled every 6 hours, as it says on my mark, so it's very important not to skip a dose. Also, this medication will going to make you dizzy or drowsy. This is normal, and this medication may increase your blood pressure, but I will come back in half an hour and assess you and evaluate if you have any allergic reaction or if you are not feeling well. But I'm gonna give you the call bell if you feel that you can breathe or something is going on. You can call us, and we'll be back here soon. Okay, now before I leave the room, I'm going to one more time. Crash auto, male, hospital ID 121 2393, date of birth 1960 February 20. I have in the wristband 1960 February 20. Today's day November 30. It is 12 o'clock. This is Kerala. So I will sign. 12 o'clock medication. Okay. I'm gonna make sure my patient is in the lower and safety position. The bed is in the lower side. It's lower. The bed rails are up. I'll give the call bell. Do you need anything before I go? And he says no. He's feeling okay. As I say, I will be back between 20 or 30 minutes to check on you. But if you don't feel well, you can call me before I come. Okay? He says, yeah, that's fine. I'll do one more time hand hygiene before I leave the room. And have a beautiful day. See you later. Thank you.